Well, of course, they were hailed as superheroes during the catastrophic COVID-19 pandemic. They risked their lives to protect others under very difficult circumstances. And sadly, many did not survive. Now, as we mark International Nurses Day, we celebrate their commitment and resilience. Of course we do. Denosa wants government and employers to implement policies to protect nurses, of course, and their livelihoods. Those are two different issues. Let's discuss that with Denosa's President Simon Hlungwani making time for us this morning. Simon, hello to you, and I appreciate your time this morning. Let's first of all just talk about the first part of what we are talking about this morning is a policy to protect nurses. We'll get to livelihoods, absolutely, of course we will. What do you mean by protect nurses? Give me some meat to the bone there.
Well, good morning, Gareth, and greetings to the viewers. I must say that now that the theme of this year's International Nurses Day, which is the 12th today, is that it's our nurses, our future. The protection of nurses talks to the socio-economic conditions of nurses in the workplace. Therefore, it requires that government and private employers in the private health system itself must do their best to support nurses in the workplace. So we're referring to the question of security, the question of ensuring that there's adequate staffing, ensuring that there is as well the support mechanism and provision of consumables, such as including medication or all the equipment that the nurses require. But over and above that, the ICN has released a report that suggests or has, in terms of their survey and the research, it demonstrated that post-COVID-19, many nurses are suffering from post-traumatic distress, from depression, from anxiety. As a result, nurses require support in terms of socio-economic support, psychosocial support, and many other means, but that includes as well the low pay that nurses are suffering in the current setup of South Africa. This is what we are referring to when we say support. And it is a call that ICN, the International Council of Nurses, which is the custodian of this day, have said, and they have released a charter for change, and they have got 10 pillars, which they are calling government to hit the call. And if they can support and as well as invest in those areas, it will be looking forward into improving the health systems in general by improving nursing care. Because in the setup of South Africa, we are having around 49% of nurses that are going to be retiring in the next 15 years. We need to have an equal value or even more of the replacement of those nurses. So it means there must be investment in training of nurses that are going to replace the very same ones that are going to move out of the system in the near future.
And you've raised a very good point. I wanted to ask you this a little bit later, Simon, but let me ask you now, because you're talking about those nurses who are retiring. I get the sense that with all the issues that you've raised as Denosa and as have been reported on this channel that nurses are going through, not earning enough, being overworked, putting their lives at risk during COVID-19, why do you think anyone who wants to go into nursing would even want to do it as a career? It doesn't come across as particularly appealing. Of course, incredibly important, they are heroes, but seeing how nurses are treated in our country, why do you think somebody would even want to go into nursing unless these conditions change?
You are correct that the profession of nursing itself, because of the many neglects that has happened in the past, which, by the way, even during the time of COVID-19, there was a neglect of services that were at that time very essential. However, because the focus was on COVID-19, it created a backlog. As a result, at the current moment, nurses are having burnout, but the profession itself, because of lack of investment, a lot of people do not see it as enticing, as it were. But what we can say is that the fulfillment of the nursing profession and the nursing care, it's when you see those who come to your hospital unable to walk, those bleeding from car accidents, trauma of any kind. When you see them walking out of a hospital, you see the fulfillment that at least my contribution has made a tremendous improvement in this particular person's life. But moreover, we all remember that the many people of South Africa have been injected by the nurses in terms of immunization for COVID-19. So the profession itself, its contribution to society, it's enormous, and it is evidently clear to that. What we lacked was investment and commitment to make sure that the socio-economic conditions of the nurses is improved, as well as the working conditions which will be provided in a positive practice environment itself. You will remember that even during COVID-19, many nurses have gotten ill of COVID-19 and many have died. And partly, some of them died because those who were in the supply chain and purchasing PPE were purchasing poor quality. As a result, some were pre-exposed just because they were not taken care of. So we are saying the improvement in the working environment, including the salaries of nurses, would attract more, and including the youth, to come into the profession and therefore becoming professional nurses even for the future, to take care of everyone else, including ourselves, by the time that we shall be retiring ourselves.
And it's so urgent as well. Imagine 15 years from now, we could have a shortage of nurses as well. I know there's an argument there aren't enough nurses now, but imagine in 15 years, to your point, Simon, when a lot of them do go into retirement, a well-deserved retirement, I might add. Very briefly, I'm going to say goodbye to you in a moment, Simon. Minister of Health, on this. You're telling me, you're telling South Africa all of this. I imagine this has come up with the Minister of Health. What's been said there, and do you suspect anything's going to change? Very briefly.
Well, you would imagine that in Chris-Hani Baragwanath, before 2020, they used to take, and this includes the SG Lawrence and Laskin Nursing College in Gauteng, they used to have an intake of around 300 students on annual basis. Right now, when they have taken a large number, they will be only taking around 80. It tells you that it's just below around 25% of what they used to take. So we as Denosa, and are the only members in South Africa of the International Council of Nurses, we have shared with the department, and that's why we're calling upon them to heed to the call of the ICN. We have shared the 10 pillars of the areas that must be addressed. Included among them is to address the human rights in the country. So if they prioritize the rights of citizens, they should invest in health. And if they prioritize that we should achieve universal health coverage in South Africa, which we call national health insurance, it means they must invest in health. And we will keep on talking to them, including engagements, informal meetings, that these are the areas that they must address, but they must firstly adapt and adopt this Charter for Change released by the ICN and supported by the World Health Organization, if they are serious that we should achieve universal health coverage in our country. And we are calling the country, including yourselves and everyone else, to keep on reminding government that these are the areas that we must address if you want us, when we retire, to be taken care of by the nurses, as we all require health care at any given point, including when people are younger, to that effect. So we need your support, including the community in general.
Yeah, absolutely. Who's going to help those who helped everybody else in their times of need? I think you've summed it up very nicely. Simon Hlungwani, thank you very much. And all the best to you, your union members, and every nurse, and also, to be fair, every medical practitioner in the country on this International Nurses Day.